Welcome to this video about IVF and ICSI treatment. Soon you will be starting IVF or ICSI treatment and will be speaking to a doctor from our fertility department. At a later stage, you will also meet one of our IVF nurses. With this video, you can prepare and inform yourself beforehand. If this is the first time you're undergoing IVF or ICSI treatment, you will always begin the process by discussing the chosen procedure with a doctor. Later on, you will also discuss more practical matters with the nurse. With this video, we hope to prepare you for these discussions. Please take note of any questions that arise so that you can address them when meeting your doctor or nurse. Before starting treatment, we take blood samples from both partners to screen for the presence of several infectious diseases. The results of these tests must be known before being able to begin treatment. IVF is a fertility treatment where fertilization of a woman's egg cells occurs outside the body. IVF stands for in vitro fertilization. During IVF treatment, we use hormones to stimulate multiple egg cells to mature. Each egg cell is found in an ovarian follicle. When the egg cells are mature enough, they are sucked out of the follicles and are then fertilized with sperm in a laboratory. If fertilization occurs, we call the resulting cell an embryo, which is the earliest stage of a baby. If there are only a few sperm cells available, it is not possible to conduct IVF, and we carry out an ICSI procedure instead. ICSI can also be an alternative option in cases where no fertilization occurs during IVF. During ICSI treatment, a sperm cell is injected directly into the egg cell in the laboratory. For you as a patient, there is no noticeable difference between the IVF and the ICSI procedures. The objective of IVF treatment is to have a child. Whether or not it is ultimately successful depends on the individual circumstances of each couple. The quality of the sperm and the egg cells influence chance of success, for instance, as does the initial cause of the infertility. In about half of the couples who attempt IVF, IVF does not lead to a pregnancy. And even if a pregnancy does occur, there is still a chance it could lead to a miscarriage or an ectopic pregnancy. After 3 IVF attempts, the probability of giving birth to a child is roughly 50%. So what can we do to increase your chances? A healthy lifestyle is a very important factor in fertility, so stop smoking, drinking alcohol, and any drug use. A healthy weight is also important, and this goes for both men and women. If you do not yet do so, you should also immediately start taking folic acid. Folic acid minimizes the likelihood of various congenital defects such as spina bifida. There are several risks associated with IVF, mainly as a result of hormone administration and the egg retrieval procedure. There is a small risk of bleeding or infection. There is also a possibility of developing ovarian overstimulation syndrome. The probability of this happening is greater when more than 15 follicles start maturing. If there are more than 30, we may stop the treatment or choose not to transfer the embryo at that moment in time. Sometimes an early pregnancy goes differently than anticipated, such as it is ending in a miscarriage or an ectopic pregnancy. There is also always a small chance a child develops a congenital defect. With IVF or ICSI, the risk is roughly 1% higher than a spontaneous pregnancy. If we transfer 2 embryos during IVF or ICSI, there is also a higher risk of a multiple pregnancy. The long-term repercussions of IVF or ICSI treatment for the health of the mother as well as the child are closely monitored. There is no associated increased risk of ovarian or breast cancer, and so far any other consequences have been negligible. It is possible that your body doesn't adequately respond to the hormone treatment. This occurs more often in women aged 39 or older, as these women have fewer egg cells. For this reason, we start with the maximum dosage of hormones in this group. Does hormone treatment lead to the maturation of 2 follicles or less? Unfortunately, this means IVF will most likely not lead to a pregnancy. We will then be forced to discontinue the treatment. There is also a chance your body reacts too strongly to hormone treatments and develops too many follicles. This can be a reason to temporarily stop treatment and re-initiate it at a later stage with a lower dosage of hormones. It is possible that this is not seen until the moment of egg retrieval. The decision can thus be made there and then to not transfer any fresh embryos, but to freeze them for future use. It can also happen that no egg cells are found. Likewise, there is a possibility that there are no identifiable sperm cells. Fever and antibiotic use in the run-up to treatment can influence sperm quality. It is very important to report this to us if this has been the case. After egg retrieval or follicle aspiration, you will be asked to monitor both your weight and temperature. It is important you have access to a thermometer and a weighing scale before starting treatment. In the Netherlands, it has been decided that we will only transfer 1 embryo at a time during the first and second IVF attempts. This is in order to avoid a multiple pregnancy, and these pose more risks for mother and child. If you are aged 38 or older, or if you have reached your 3rd IVF attempt, you are allowed to transfer a maximum of 2 embryos. There may also be a medical reason for only transferring 1 embryo at a time. Your doctor will discuss this with you if this is the case. It is important we have agreements on paper before starting the IVF treatment. This is both in your best interest and the hospital's. We will detail various agreements, rights and duties with regards to the treatment, the use of patient data and the storage of embryos. There is a difficult part of the contract which you may want to think about in advance. What would you like to happen if one of you should come to pass away? The partner left behind may still want to have children. According to Dutch law, we must have permission in advance to be able to store and/or use any previously frozen egg cells, sperm cells, or embryos of anyone who has since died. Throughout IVF treatment, there are some bodily tissues and materials that we do not end up using. This can include egg cells, sperm cells, or embryos, which are deemed unable to lead to a pregnancy. This material can, however, still be used to test new instruments or to train new staff. It will never be used for other patients. It is necessary to be able to do this in order to improve treatment quality. After use, any leftover material will be destroyed. The doctor at the outpatient clinic will ask you to give your permission to do this. The costs associated with the first 3 IVF attempts are covered by standard Dutch health insurance, excluding your own risk contribution. The covered treatment consists of the required medications, the egg retrieval procedure, and the embryo transfer. The use of frozen embryos from previous egg retrievals is considered part of that IVF treatment and doesn't count as a new attempt. As long as you don't have any new egg retrieval procedure, your insurance will not see this as a new IVF attempt. We will require to submit a bill to the insurance company for both the man and the woman. Since laws and insurance policies can change, we do advise you to read your insurance policy statement closely prior to starting IVF treatment. After speaking to the doctor, you will have an appointment with one of our IVF nurses. They will discuss the treatment itself and more practical matters associated, such as the treatment schedule and injection instructions. There are different types of treatment schedule. Your doctor will discuss with you which one best suits your situation. The nurse will then give you your personalised schedule. Here you can find exactly what you have to do and which medicine you have to take at what time. It is vital that you follow your schedule as closely as possible. The medication that you will use must be collected from the hospital pharmacy. The IVF nurse will explain to you which medication you need to take at which moment and will show you how to inject yourself. All the medications you will use during the treatment process have specific effects. First, you may be put on the contraceptive pill to regulate your menstrual cycle. The pill also prepares your body for the beginning of the treatment. Subsequently, medicine administered by injection will be responsible for growth and maturity of ovarian follicles. Another medicine will prevent premature ovulation. Together, these different medications will increase the probability of having enough sufficient ripe egg cells to start IVF. The various medications can give you side effects. You may experience headaches or abdominal pain. You may also feel tired or less in control of your emotions. The hormones may also lead to fluid retention. It is possible you experience redness or a burning sensation at the injection sites. You will have to inject yourself one or more times on specific days at specific times. The IVF nurse will always make sure to give you a clear schedule and detailed instructions. The IVF treatment process is made up of several steps. Each step is associated with a different form of medication. There are injections which are responsible for regulating ovarian follicle function. There is medication which ensures that you do not ovulate too early, and yet another medicine maintains the uterine lining. We will monitor the growth and response of the ovarian follicles using regular transvaginal ultrasounds. When the follicles are large enough, we will schedule an egg retrieval or follicle aspiration procedure. The harvest eggs will then be fertilized in the laboratory. In the laboratory setting, we handle the egg cells, sperm cells, and embryos with the highest possible standard of care and precision. Follicles are situated in the ovaries and are vesicles filled with fluid in which an egg cell can be found. During a follicle aspiration procedure, the fluid containing the egg cell is collected. This is done by a doctor with a needle which is brought in via the vagina. The whole procedure takes about half an hour. Some women find this procedure painful. In order to minimize discomfort, we will give you painkillers in advance of the procedure. A nurse will also be there to support you and offer tips, such as certain breathing exercises. Please be aware that you will not be allowed to drive on the day of the egg retrieval, as a result of the medication we give you. Are you very anxious about the egg retrieval procedure, or have you experienced something unpleasant in the past? Then it may be possible to undergo the egg retrieval procedure under sedation. During sedation, you will be put in a state of reduced consciousness and receive pain-killing medication through an IV. You will still be able to breathe independently. It should be noted that, as it is necessary to employ a specialist team for this procedure, It is not always possible to carry out the egg retrieval under sedation. The fertilization of egg cells by sperm cells happens in a specialized laboratory. Our IVF laboratory is located in Tilburg. This means that the partner of the woman undergoing the egg retrieval procedure will have to bring the harvested fluid to Tilburg on that same day. The egg cells and fluid are stored in sealed containers in a special transport case. The case can be attached to a standard 12-volt outlet in the car, which will ensure that the egg cells remain at the optimal temperature. In the lab, they will start by identifying if egg retrieval has been successful. On the day of the retrieval, the man must also produce sperm. There is a special room for this in the IVF laboratory. The lab technician will then select the best sperm cells for fertilization. The laboratory fertilized egg cells should, in theory, develop into embryos. Several days after fertilization, we then transfer an embryo back into the woman's uterus. Embryo transfer is painless. Beforehand, we choose the embryo that seems most suitable for transfer. After transfer has been complete, you will enter into an uncertain period wherein you must wait and see if you become pregnant. Unfortunately, it is possible that no suitable embryos will be available. Potentially, the fertilization of egg cells in the lab could lead to the development of multiple viable embryos. Any remaining high-quality embryos can be frozen and used at a later time for another embryo transfer attempt. We call these frozen embryos cryos. About 2 weeks after embryo transfer, you will be contacted by the IVF nurse. If you are pregnant, we will then schedule a pregnancy ultrasound. If the transfer was unsuccessful, you will discuss next steps with your doctor at the outpatient clinic. It is important to remember that not every treatment will lead to a successful pregnancy. If you feel you're in need of additional support or would like to speak to someone about how you are feeling, please discuss this with the nurse or your doctor. Together with you, they can assess what they can arrange for you. General disclaimer. The Catharina Hospital has taken care to make sure that the information provided in this video is as clear and as accurate as possible. Despite our best efforts, however, it is possible that some content is incomplete and/or incorrect. If you experience acute medical or psychological problems or a worsening of symptoms, we advise that you promptly contact our department using the contact information provided to you.